We begin, I guess, our ninth hearing on health reform. I want to thank the staffs, minority and majority, for bringing us to this point in our nation's history where we do see light at the end of the tunnel for one of the most serious domestic problems our great nation has faced. It's abundantly clear that we have a serious financial problem as the cost of health care escalates far beyond our imagination and continues in this upward spiral. We have a moral obligation in terms of the number of people who've lost their homes, gone into bankruptcy as a result of the costs of providing health care. And of course, we have a crisis in terms of the waste and inefficiency and the misuse of our resources by health providers that find us in need of changing the entire system. We hope at the end of the day that we're able to say that those people who find that their insurance meets their needs, that they should rest assured that we have enough problems without interfering with the relationship they have with private health insurers. They will have to be able to understand, however, that in their search for profit, there has to be basic sound principles that health care providers would have to be involved and support. One thing for certain, the whole idea that insurance companies can pick and choose the healthiest of their clients is wrong, and it will be corrected as we make certain that those people that have preconditions will be acceptable. We know that there's so many employers that want to provide health care for their employees because it's the right thing to do, and they just can't afford to do it. And we've got to give them assistance. We know that there's nobody in the United States that's an adult and understands the problems we face that hasn't got a horror story, with or without insurance, as to what has happened to their families and indeed communities because the system is broken. We also know that we just don't have enough primary care doctors and nurses and support system. And we've got to encourage these people, in order for us to be healthy and competitive with foreign countries, to be out there, not just looking for profits, but looking to fulfill their life's work in terms of taking care of our sick, and more importantly, or just as important, to make certain that we avoid these serious and expensive illnesses. We have the support of the President of the United States. We sincerely wish that this could be a bipartisan effort. The book is not closed. We have before us a discussion draft. And we've had more discussion than we had thought we would have, which I think is healthy, so that at the end of the day, when we pass this, more and more Americans would understand that we've done the right thing. And certainly the polls, for what it's worth, overwhelmingly believe that what we are doing in terms of having a competitive public option so that people can go to the exchange and pick and choose with a variety of private options, just as we in the Congress have, and also a public option, we think at the end of the day, it's going to be the American citizens that will be the beneficiary. The industry will be improved, America will be stronger and more competitive, and we all are privileged to be able to be participants in this effort.